So the CDC issued new guidelines today in a 60-page report on how to safely reopen schools and restaurants and mass transit. It also included a warning that some institutions should stay closed for now. For example, it is also calling for sneeze guards on the school buses and in-class lunches rather than in cafeterias. And it also says, after we have all been wiping down our groceries, leaving stuff outside, that in this new report, they found that the virus, quote, does not spread easily from touching surfaces or objects. So here now to help us sort this out is Dr. Richard Besser, former acting CDC director under President Obama and president of the Robert Wood Johnson Foundation. He is also on New Jersey Governor Phil Murphy's reopening team. Dr. Besser, thank you very much for being with us tonight. Good to have you.
Thank you, Martha. It's great to be here.
So what do you think about that? It is interesting because we were told originally all these scary stories about how it hangs in the air for 24 hours. And then if it lands on metal, it's there for 48 to 72 hours or on packages. That was really, a bit of the early panic in all of this. Why would that change?
Yeah, this is one of the reasons why it would be so valuable to hear from CDC scientists every day. Early on, when a new infectious agent appears, what we don't know far exceeds what we do know. So there's work that's done in laboratories. So work in a laboratory may say, well, we found in the laboratory this survives for a certain number of hours on different types of surfaces, and we can find it in the air. What you then need to do is say, okay, let's look in the community at what are the important ways this is spreading. And that's where you can see, yeah, well, in the laboratory you found that, but we found in the community that it's really being close to somebody who's sick within 6 feet. That's the important thing. And those other ways are not so important.
Yeah, it basically says that, between people who are in close contact within 6 feet, through respiratory droplets, coughing, sneezing, all the ways that we, sort of would anticipate in a normal situation. But this is, much more contagious. So why is it, do you think, so much more contagious? Or is it, given what we're learning now?
Well, there's still a lot of unanswered questions in terms of that. When I compare it to something like the flu we know spreads really easy between children. Children get sick, they spread it to each other, they bring it home. One of the unanswered questions here is how important are children in disease transmission? And that's critically important because we all want to get our kids back to school this fall. And if we can understand how do we do that in a safe way, as a parent, as a pediatrician, I want to know that the safeguards are in place to limit the risk as much as possible. We can't eliminate it, but can we drive it down so that people are comfortable getting their children back to school?
Yeah, let's hope. One of the things that has taken on a lot of significance is getting everything reopened. And as I mentioned, you're on Governor Murphy's reopen team. And I've spoken to a lot of doctors who say, look, we need to go back to school. We need to go back to work. This is from a group of 600 doctors who wrote a letter to the president urging the end of the shutdown. They say the millions of casualties of a continued shutdown will be hiding in plain sight, but they will be called alcoholism, homelessness, suicide, heart attack, stroke, or kidney failure. In youths, it will be called financial instability, unemployment, despair, drug addiction, unplanned pregnancies, poverty, and abuse. What do you say to that, doctor?
Those are all important things. And yes, people have to get back to work. But one of the concerns I have is if public health is put up as the enemy of the economy restarting instead of as the roadmap. We want workers to get back to work, but it should be done in a way that they feel safe and comfortable that all the protections are in place. And we want people to go back to businesses, but they have to feel comfortable that going into a store or a restaurant won't put them at increased risk. So, data, understanding where this is transmitting and where it's not, places where it's going down significantly and they have the capacity to test people and to figure out who they've had contact with, and make sure that those people are in a safe place so that they don't spread it to others, then those are the measures. And so seeing this guidance from CDC will give a lot of valuable information to businesses, to schools, to consumers, so that they understand how to do this in a safe way.
Well, a lot of people in New York and New Jersey who are desperate to get back to work, to feed their families and to get back to their lives. So hopefully the council that you are on in New Jersey will help us get to that goal as soon as possible. Doctor, thank you very much. Good to have you here tonight.